LHP has three distinct work streams. These are research, education, and the development of clinical strategy. We derive very high quality research knowledge, use that to drive really better quality clinical strategies that are going to translate into better quality clinical care. But actually the glue that binds these two particular sort of very vital elements is that element of education.
My particular role is to encourage education in two particular fields. One is where there is new innovations, so either some new technique comes along, or recently the Francis report, and my job is to make sure that the staff are educated in these areas. And the second part of my role is to look at how we can improve the education of individual members of staff within the partnership. It's said that it takes up to 10 years to get from the bench into clinical practice, and sometimes we can beat that, but it can still take a long time. I'm a rheumatologist, and we had a very new and powerful group of drugs called the biological therapies, and that required every rheumatologist in the country to be educated about these particular drugs as they came through. My colleague here set up an education program locally, and all the consultants went along to it. And it's that model that we're trying to use. If there's evidence to say that is the right way to do it, my job is to make sure we get it in quickly.
One of the things we believe that Liverpool Health Partners will do is ensure that we use education as a changer of systems rather than thinking in the traditional models of here's a course, come and do it. We also have various plans in hand to actually develop the workforce that works in the NHS, and this includes all healthcare personnel, not only just doctors and nurses, but allied health professionals as well, in terms of how we actually improve the knowledge and the way and the skills and the behaviours even of the workforce that work for the partnership.
So we're looking at building MSc courses, multidisciplinary ones, so there'll be medical ones, there'll be nursing ones, and physiotherapy, and all for all members of staff. My aspirations for LHP as a whole is really trying to see this collaboration going on for more than the next 3 years, and that means that within 3 years we've got to be having some big hitting areas that we've been able to show, and that's why I think education may be at the forefront of a lot of the LHP drive over the next number of years.
What I'm looking forward to is a really heady mix of academia, high quality clinical care, education.
It certainly is a very good method of fostering excellence, I believe, across the partners, and I think there is a danger that if we're not careful, that the people just outside the partnership may feel left out. If we're able to demonstrate centrally that this is good practice, we must make sure that's disseminated widely. The point of Liverpool Health Partners is, when it's the right thing to do, is to encourage people to work together. And I see my role in education trying to make sure that that is not a frightening process, that's something that's logical, that's sensible, that if you actually sit down and think about it, is the right way forward. And Professor Kuhar's and my responsibility is to make sure that that education is fed across all the partners.